According to the Scheiman Institute School of Industrial and Labor Relations at Cornell University, about 550,000 Americans file for bankruptcy every year because of medical debt. That accounts for about 66.5% of all bankruptcies filed in America. High costs on medical care either are or will affect all of us in our lifetime. As such, it's important to understand the factors contributing to these costs and how we compare to other nations. You might be wondering why I chose this topic. Well, that's because back in 2017, I was one of those 550,000 people. After a billing error, I was left with about $50,000 in medical debt, and after countless hours on the phone with TriStar Health's billing department and my insurance company, I was never actually able to get it resolved, leaving me stuck with all that debt. We're going to talk about three reasons why medical care costs are so high in the U.S. First, we're going to talk about how much we actually pay and how it relates to other nations. We're going to talk about what we're paying more for, and then some of the reasons why. First, let's look at how much we actually pay and how it compares to other nations. The U.S. spends more per capita on healthcare than any other nation in the world. According to an article published by Johns Hopkins University in 2019 on their website, from a data set in 2016, the U.S. averaged about $9,982 per person, which was 25% higher than the second highest, Switzerland, who averaged about $7,919 per person, and 108% higher than Canada, who averaged about $4,753 per person. Now, in a more recent data set, as you can see in this graph behind me from 2019, that was published in 2022 by the World Economic Forum, the cost for healthcare in the U.S. climbed to about $11,000 per year. And it's not just that we're paying more; we're paying more for objectively less, at least when it comes to the metric of life expectancy as a means of judging healthcare. As you can see, the U.S., we paid about $11,000 per person for healthcare, and our average life expectancy was about 77.3 years. Whereas the next highest payer, Switzerland, paid about $9,666 per person, and their average lifespan was 83.1 years. And then Canada paid about $5,048 per person, and their average life expectancy was 81.7. So as you can see, we're paying more, and we're objectively getting less, at least when it comes to life expectancy. So where's all the money going? Well, we're going to talk about two of the places that the excess expenditure goes. We're going to talk about administrative fees and prescription drug costs. As you can see, administrative costs account for about 30% of the excess expenditure. Now that's administrative costs for insurance companies and for providers. And then the next highest cost is prescription drugs, which account for about 10% of all the excess expenditure. But this number can be misleading. We actually pay between 200 and 300% more than for name brand prescription drugs than any other nation. Now that we know where the money's going, you might be asking yourself why. We're going to discuss three reasons why. According to David Armstrong, in an article published on ProPublica's website in 2025, the reason that prescription drug prices are so high is because the pharmaceutical companies get to set the prices. In other nations, the government gets to negotiate with the pharmaceutical company, and then they come to an agreement on the price. However, here in the U.S., the pharmaceutical company sets the price, and there are very few restrictions on how much they can charge. The next reason we're paying more is lack of price transparency. According to Kristen Deacon, a healthcare policy expert, in testimony before the Senate earlier this year, lack of price transparency enables dominant market participants to dictate prices, control access, and avoid accountability. Then the third, and probably the most prominent reason for the spike in healthcare prices, is consolidation, which should come as no surprise. Consolidation's been a problem in this nation ever since industrialization. But according to Lindsay Copland, in an article published on the Medical Rights Center's website in 2025, consolidation of physicians is the leading cause of excess healthcare costs. And it's not just that hospitals are consolidating physicians under their own umbrellas, it's the fact that private equity is also getting involved in healthcare. And when private equity gobbles up all the providers, it's easier for them to dictate the market and set higher prices. Now that we have a better understanding of how much we pay, what we're spending it on, and the reasons why, it's time to wrap this thing up. So we've covered how Americans pay considerably more, how we're paying that on administrative costs and prescription drugs, and how pharma can set the prices, lack of transparency, and consolidation also contributes to the increase in price. Hopefully, after listening to this, you have a better understanding of why medical debt is crushing so many Americans and why nearly 2/3 of the bankruptcies in America account for medical debt.